Good morning, afternoon, everyone. Thank you for joining us today. I'm pleased to welcome Dr. Cecilia Lohr and Simone Collins, who are going to lead today's session. So we'll have folks trickling in a bit, but yeah, we will get started. So I hand it over to you, Celia.
Hi, everyone. Thank you for joining for the first of a series related to implementing together. So this is hosted by the Child Bright Network, for those of you that aren't part of the network, and the training and capacity building group that's here. So I just will introduce myself and Simone in a moment, but wanted to start off with a land acknowledgement. So for myself, I am situated on the Haldeman Track. So this was land that was promised to the Haudenosaunee of the Six Nations of the Grand River, and it is within the territory of the neutral Anishinaabe and Haudenosaunee's people. And the photo that I include here is a park just down the street from me that I spend a lot of time walking by. It's a nice open space filled with flowers and trees. And about a year ago, I heard that this land was being going to be used for reconciliation purposes, and heard a lot about that at the beginning, and then I never heard about it again. So it was when I go by there, it's part of the acknowledgement that I think about the work that needs to be done to be able to support that ongoing focus on those reconciliations, so that projects like this don't end up falling by the wayside. So now I will pass over to Simone.
Thanks, Celia. I wanted to acknowledge that I'm privileged to live and work in Halifax in Nova Scotia, which is the traditional territory of the Mi'kma'ki people, and it's the Mi'kma'ki land. And this is a land that's governed by the treaties of peace and friendship. And I wanted to express my gratitude to the Mi'kmaq people for their ongoing stewardship of this land. And I also want to acknowledge that Nova Scotia is home to over 50 African communities whose culture, heritage, and histories have been and remain a key part of this province for 400 years. And the photos that I've included here is a photo of IWK Health, which is the Women's and Children's Hospital that I work at in Halifax. And I've also included a photo of an amazing coastline from one of the first hikes that I did here when I moved to Nova Scotia. And I also wanted to acknowledge the lands where I come from in Australia. That's the lands of the Wurundjeri First Nation people of the Kulin Nation, who are the traditional owners of the part of Australia where I'm from. And I recognise that the sovereignty of that land has never been ceded, and also acknowledge the resilience and resistance of the elders past, present, and emerging.
Thank you. So for our presentation today, Simone and I wanted to give you a little bit of an introduction to how we got involved in implementation science, kind of our journeys to be able to get here, which kind of shows a little bit of an introduction to the field overall, and kind of why we think that it's important. I'm also going to explain a little bit about the series that we are launching. And how some of the upcoming topics came about. Then I will go into a little bit about what I mean by implementation science, a couple of definitions, just to be able to keep us going. And because implementation science goes through a lot of theories, models, and frameworks, explain a little bit about why I think those are important in a way that I'm hoping will not make you run away in fear when you hear those words. And then I will pass over to Simone, who will talk us through how all of that is being applied across the Child Bright Network and using implementation science to understand implementation science. So that is the plan. You're welcome to ask questions during my presentation at any time. I am very bad about seeing the chat, so if there is anything that's crucial, please feel free, or somebody can jump in and we can discuss it then. And we've got time for questions at the end. So just to get us started, we've got a poll just to understand kind of where you're at with implementation science. Is this something that you are not familiar with at all, just decided to join to learn something new, heard about it but not really sure, have a general understanding but still want to learn more, more experienced, or if you feel like you're an expert in explaining and applying implementation science, I would like to chat and I've got lots to, to ask of you for that. So if you can add in your responses. Right. So we've got pretty much everyone answering, and I'm not entirely sure what everyone can see, but Pierre, I think we can show the poll if others can't see it yet.
Yes, it should be shared now, Celia.
Oh, excellent. So it looks like there's a general understanding. So knowing the basics, but haven't done work focused on implementation before, with a couple experienced and a couple not familiar. So that is great. We're going to be fairly high level with some of it, but still providing a few introductions to the topic. So that's great. Thanks. Okay. So I'm going to start off by sharing how I got involved in implementation science. And for my early studies, my undergrad, I knew that I wanted to do something health-ish, health-related. I didn't want to go to medical school, but I still wanted to be able to work in something related to the healthcare field. And then wanted after a fairly broad undergrad was thinking about ended up in a public health nutrition program. And what I realized in that program is that I have very broad interests. And the emphasis on nutrition was one of the ways to be able to be really cross-cutting across a lot of different areas, different conditions, lots of different ways to think about that on the public health side of things. And I ended up working for a nutrition education program in the UK where we really supported healthcare professionals to learn more about nutrition. But what I was um, where I kind of started to get a little bit stuck was knowing that as much training and education we could provide, if somebody didn't have the opportunity to be able to apply that, they weren't in a setting that considered any of these factors, how are we ever supposed to make any sort of change within anything if we were just relying on a couple of people to really drive that forward? And I swore completely, hands down, would never do a PhD. And then I applied. So I heard about the term implementation science from a woman that I ended up being my PhD supervisor. And we ended up learning this topic together because it was quite new. There wasn't a lot of training available, but knew that there was a lot more than just education and a lot more science that could come with this. How do we understand those underlying processes of how do you make change? How does that connect? And I ended up doing a project that was working on improving nutrition care in hospitals. So I got to work really closely with nurses and dietitians and patient partners, all as part of building, implementing what we'd learned. They'd done a ton of research before I got there about what the challenges were, what the barriers were, and now we were actually working on getting that into place. And it was a really exciting time. We were all learning about this together. And then I saw this graph, which is one of my favorites, and it doesn't look like much. And I won't go into the details of what it means, but that black line is the change that we were able to make. So, in terms of they started there, some people were making that change, and by the end of the study and that first piece, almost every site was implementing nutrition screening. But what was so cool, and what I really wanted to understand more, is that we had a gap of about a year between the studies. And when we came back and started collecting data again, that black line continued, which means that change had been sustained. It was continuing, even though we weren't doing anything there. So I really wanted to know more about how that happened. How do you keep programs going? What does it really come down to with sustainability? And that led me to the role that I have now, which is in all topic areas. So I don't actually focus on any specific clinical area and apply asking the how questions across a lot of different spaces, and now part of the Office of Spread and Scale. So we really focus on how do we use implementation science, how do we support others to be able to learn about this, with a big emphasis on how do we sustain and keep it going. So that's kind of how I ended up looking at implementation science and being in that more general role that I am today, and how I get to be privileged to be able to work with people across a huge number of areas. And so the hats that I wear today, and one of them, and my main hat for today, is as co-lead of the Training Capacity Building Committee with the Child Bright Network. So that helps support the training, the trainees to learn about implementation science, as well as other patient-oriented research areas across the network. Scientist at Women's College Hospital, and also a mentor, a teacher, an editor, support, all of those other things that I see as a big part of my my role in the system. And I'm also a mom to a wonderful 2-year-old that is very active and rambunctious, although learning lots of new things right now, and a wife and a sister and a daughter and a friend that kind of brings all of my my perspectives together. So I will now pass over to Simone for her kind of journey to implementation.
Thanks, Celia. In some ways, my journey was a bit similar to Celia's. I went to university a couple of years after I finished high school. I wasn't really sure why I was going or what I was going to do. I just wanted a good job that made a difference. So, I mean, that's great, but it wasn't particularly helpful for a career. But I enrolled in a Bachelor of Arts, picked my favorite high school subjects because I thought, why not? What else am I going to do? And very quickly, psychology won my heart over philosophy. But I realized that to get a good job in psychology, I needed more than just a bachelor's degree. So I enrolled in an honours degree, and then I realized still to get that good job, whatever that was going to be, that I needed more than just an honours degree. And so I enrolled in a PhD in psychology. And so during my PhD, I became really interested in learning difficulties, and my research there was looking at learning difficulties in children that were born very preterm. And that was great. I went on to do postdoctoral fellowships in Australia that were focused on learning difficulties in very preterm born children, as well as with another team building community partnerships with organisations that supported children with acquired brain injuries across Australia. But I just felt that there was something missing in what I was doing, and how could I take the things that I was learning through my research and actually make a difference. And so I thought implementation science is how I'm going to make a difference. And I did a lot of thinking, a lot of like, how am I going to get this skill set? And I'd heard about the Child Bright Network from Australia. I was really interested in the work that happens across Child Bright, because obviously there's a lot of overlap. Child Bright is focused on similar populations, and I was up for a move to Canada, and there just happened to be an opportunity with the Implementation Science Research Program at Child Bright, and I applied and was successful. So I packed up myself and my husband, and we moved to Halifax almost 1 year ago on Saturday. So it's nearly the 1 year anniversary of being here in Canada, which is quite exciting. So now my work here is really focused on understanding the uniqueness of children's lives and how we can leverage that uniqueness and the uniqueness of pediatric healthcare settings to better implement interventions for children's healthcare. And we'll talk about some of the work that we're doing there later in the talk, but it's something that I'm quite passionate about. And if we don't, I think particularly everybody here on the call has a great appreciation for the fact that children aren't just small adults. There's a lot of things that are different about the lives of children and about pediatric healthcare, but implementation science has really grown from an adult perspective. And so I want to see what can we add from a pediatric perspective. I also wear a number of hats. So as said, I'm a postdoctoral research fellow with the Implementation Science Research Program at Child Bright, but I also play a postdoc role in the Strengthening Transitions in Care Lab at the IWK Health Centre. I'm a mentor, teacher, standing board supervisor. As Julie said, all the things that also go with these roles. And I also wear a number of hats outside of my academic work.
So now that you know a little bit about both of us, I wanted to provide a little bit of background on why we started to develop this series that focused on implementation science. And for those of you that know the Child Bright Network, know that when we started in this phase of work, the term implementation science was fairly new to most people across the network. It wasn't something that had been thought about too much before, but we've come a long ways. And there's a lot that has been learned across the network that we can or want to be able to share with others, to be able to share in that learning while we're also still learning from each other and from others. So I wanted to use this opportunity to highlight Child Bright projects while also learning about some of the underlying aspects of implementation science. So the way that each one is designed is to begin with more of the kind of background stuff. For this session will be the background on what do we mean by implementation science, by theories, models, and frameworks. And then the second half will be how does that really apply to the field, to these examples? Where is it actually used? And having people with lived experience, people involved in these projects to really highlight their experience and how they've been able to bring these pieces together and how we've learned as a network. I also wanted to use this as an opportunity to really highlight and give opportunities to early career individuals across the network. So trainees and postdocs and early career assistant professors that are doing amazing work and wanted to provide opportunities for them to share that along with the people with lived experience that they've been working with. So a lot of them, the upcoming sessions are run with several individuals to be able to highlight their experience. So the next one coming up, which we'll share more about, is about barriers and facilitators. I heard this in a call a little while ago, and why does Child Bright keep talking about barriers and facilitators? So I wanted to delve into that a little bit more. What do we mean by that? What are some of the ways to look at that, and how are some of the Child Bright projects approaching this? Also knowing that implementation means going beyond training and education. There's so many other ways to make some of these changes. What do we know about the science and how is that connecting? And then overall, how are we thinking about sustainability of the network and how do we bring in implementation science tools to support sustainability of implementation science within the network? We get a little meta with some of these things, but really wanting to use that as a showcase of what are some of the tools that help planning for sustainability while also highlighting some of the results that have come out. You've heard little bits of it before if you came to some of the previous sessions about this, but some of the more detailed look at the sustainability planning for the network. And then we've got something about evaluation that we're still figuring out what that looks like, and other topics that we're open to exploring. And part of how we picked this topic and is part of how I introduced some of Simone's work, but we started with a survey, as you generally do, to see what the needs of the network were. But we didn't end up hearing too much because there was quite diverse needs. It changed over time, and weren't really able to narrow that down too well to be able to make sure we met the needs of the network. But Simone had been doing some work to be able to map what was happening across the different projects within the network and had this full table of what were some of the theories, models, and frameworks that were being used. So we built off that because if there was going to be a lot of projects that were all focused on the consolidated framework for implementation research, for example, that would be a great one to be able to support the network to learn more about and highlight some of those work. So that was the kind of starting point for some of these themes. And then working with trainees and postdocs to get their comfort level with these different topics, what they thought would be relevant to others, and then that ongoing learning and networking across the board. So that's kind of how we came about this series. But now I want to get into what am I actually talking about with implementation science and why do I think it's important? So if you're here, generally know that there is a lot of research that's being conducted in so many different areas, and that's great. But sometimes it can feel like a miracle when that actually gets used into place. And a lot more often, you just never hear about that research again. So there's amazing pilots with really great results, and then nothing. It doesn't continue. Or sometimes there was those pilots and it didn't really work, and we don't hear about that again. And that can be a good thing because not everything we try is going to work. But knowing what we can be able to take forward and how do we do that and how do we bring the research into the real world is where I see that value of implementation. But unfortunately, the other route, when you actually do get into full practice, it takes 17 years to get there. So 17 years later, people are actually using that, and that's just too long. We need those impacts sooner, which means we need to learn together to be able to make these changes um, uh, stronger and faster so that we can get the impact from the research that should be felt by more people, used in more ways. Right. Um, so within that 17 years, there's a lot of reasons why it takes so long. And we don't want to rush things because we don't want to be implementing something that isn't beneficial. But there's also a lot of other reasons why something doesn't get into place. And those are the ones we want to be able to overcome. So sometimes it can be that there is limited resources. Sometimes it's just people, it's hard to change practice. Somebody is very set in their ways. How do we support them to be able to change and also know that we live in a complex world? There's so many different societal factors, so many things that are at play. How do we acknowledge some of that, build that in, and really understand some of these factors so that we can overcome them? And that's where implementation science is trying to overcome and understand that process. So bridging that gap between what we know from research and from science and from practice, and getting people to actually use that in the real world and in practice. Right. And so for some definitions, there's lots of different ways to talk about this, and more of that overarching piece around knowledge mobilization, getting research used, sharing that knowledge. But from an implementation perspective, I see a spectrum here. So on the implementation practice side, where you're doing stuff, you're using strategies, you're getting things into place, ideally benefiting from what we know from the science. Building in some of those strategies that we've learned work really well. But we also know there's a ton of gaps. There's a ton of stuff that we don't know about how to make some of these changes. And that's why we need more of this implementation science, so that research side of things, that studies that underlying process so that we can do better practice, but we can also learn from practice to do better science. And these really need to be working together because implementation practice is great and that continues that, but implementation science on its own is kind of useless, in my opinion. It needs to be connected to practice. It shouldn't exist without that connection and bringing that forward. So those, everyone talks about them different ways, lots of different terms out there, but really it's at the end of the day, it's about doing stuff, getting things done, moving research into practice. Right. For better descriptions on some of this, you can check out the videos that were developed by the Child Bright Network, which were developed for youth by youth. And I really encourage you to take a look at these videos. They're pretty amazing, and we'll send them out as well for as part of our materials afterwards. Right. And just wanted to go into a little bit more around what we mean by implementation science. And the big question is around who needs to do what differently. So who are those key players and what do they need to do? And then understanding a bit more about why isn't that happening? That person needs to make some changes, but that's not happening. What is the reason behind that? What are those barriers and facilitators? And what are some of the strategies that we know that can help overcome them? And there's actually a list. Not saying that that list is the right words, it's not the right piece, but it gives you a place to be able to go and think more deeply about what are some of the other ways that you can make some of those changes, and how will you put that into place, and how will you know if it's working? So a full piece around actually knowing those changes. What are you measuring? How are you asking those questions? Not. And all of this, which is a super important part for Child Bright, is working together. So making sure that those who are impacted by the changes, so the people with lived experience, the clinicians, the managers, are all working together to understand what's going on and how do we bring those changes forward. And there's lots of different ways that people can be involved, lots of different levels, but making sure that people are involved in that process throughout is a big part of all of this work. So now, as promised, got a brief section about theories, models, and frameworks, and just going into this very briefly about why I think some of them are important. And basically, what they are is a collection of what we've learned before. So, change, and people are making these changes and putting this research and doing all of these things. The theories, models, and frameworks are some of the ways that we bring that together and have a way to be able to learn from each other. So, the similar work that's been done in other times, how do we bring that into providing us with a stronger place to start from, a stronger foundation that says these are some of the things we need to be thinking about because these were some of the things that all of the other people that did this before us found were relevant to making those changes. It can help you think through what the next steps are, and then helps you contribute to that wider piece as well about learning from others can be able to learn from your work and what you learned along the way. So a couple examples are around, some of them help you think through what are the steps? What do I need to do to be able to make some of these changes? And these are typically called process models. And it's more about some of the sequences of actions. I need to do the initial planning. I need to start with some of the implementation. I need to sustain it longer term. Doesn't necessarily need to go in the order as shown in this example here, but it helps you think through what am I going through? Am I starting too fast? We've got people that are jumping right into implementation when they really need to take a step back and think, what am I need to be doing before I even start to actually make any changes? What else do I need to know? Evaluation frameworks can be really helpful if you are trying to figure out if you can show that there is a change, there is an impact. It can be about as you develop, knowing what some of those areas are, and provides you a structure to use in your evaluation. And some of these tools also incorporate focuses on health equity, which isn't a topic that is particularly well done in implementation science so far. There is some interesting work that is coming, and a lot more recognition coming out about the need to consider that. But some of these evaluation frameworks actually support you to think about how do you consider health equity within each of these areas within your implementation. How do you measure reach, adoption? Those sorts of areas is where evaluation frameworks can help. And then again, barriers and facilitators. So the fancy way of saying that being determinant frameworks, but they are the structure that helps you identify what are some of the challenges, what are those barriers that you're going to face, and how do you overcome them? And it helps you understand what's going on, what's that context, and putting some names to some of those pieces that go with it. And one of the examples is that I've put here is the consolidated framework for implementation research. So it brings all of these different pieces, and there's way too many things in this one framework that you'll ever be able to look at all of them. But it helps you think through what are the things that are potentially relevant for me? Where do I want to focus? Where do I want to look? These are all of the pieces that were really important with implementation in previous work. And this is the 2.0 version. And what I find is quite exciting about this one is that it integrates some of the behavior change aspects, so particularly what's called the COM-B model. So that's focusing on capability, motivation, and opportunity. And why I think this one is particularly helpful is because it's one of those ones that I can remember. And when you're talking to somebody, do they actually have the skills to be able to make that change? Have they received the appropriate training? Do they know what they need to do to be able to do that? And if they do, that's great, but that's not enough. You also need the opportunity. So, do you have the chance to be able to actually apply what you've learned? And then, do you have the motivation to be able to do that? So, if you've got the skills and you've got the chance to do it, but you really just don't care, it's still not, that change is still not going to happen. So, I find this is a really useful way to start to think about that and have, when you're talking to people about some of these changes, this one can be really useful to think through. And then the science side, there's a lot more depth that we can go into about what are some of the other reasons in there. Is it that somebody doesn't believe that they've got the ability to be able to do that? And then how do you address some of that belief in providing the additional support? Or they just don't think that what you are doing is actually going to make any difference. So how do you show that that difference can be made and can be found. And then this, from the science side, we go into so much more depth on so many different things. And I think some people on the call are a lot more focused on those individual levels. But I think that capability, opportunity, motivation is a really good place to start when you're thinking about what could be some of those barriers and facilitators. So I'm going to wrap up my section by just saying that theories, models, and frameworks are supposed to be useful. If they're causing more confusion or making more seeming like it's a lot more work, then maybe that's not quite the right run for you, and it's thinking about what makes sense for you and your team. You don't necessarily need to follow every step in order with every category. Again, it comes back to being useful. And you can use more than one framework, but it can get very confusing to be able to use multiple ones, and then it goes back to not being the most useful. So I'm going to pass over to Simone now to be able to show how we've been thinking about this, or how she's been thinking about this across all of these different projects for Child Bright.
Thanks so much, Celia, and such a great introduction. That we did plan this, but obviously it sets up the rest of the talk really well. So I'm now going to focus on thinking about how do we choose which theory, model, and framework, because that's something, particularly as you're starting in the area of implementation science, is something that can be quite overwhelming. And one of the reasons is because there's over 100 theories, models, and frameworks that you could pick from. And so this can become quite a daunting task. And as Celia mentioned, there's a lot of different reasons or functions, I suppose, of the theories, models, and frameworks that you can choose from. So whether you need a framework to help guide your process, whether you need a framework to help you evaluate something, determine the barriers and facilitators, or plan for sustainability. So there have been some tools that have been developed. One really popular one is the TCAST tool. It's a freely available website that you can use. So I've got the website down the bottom. And then when you go to the tool, this is what it looks like. So the first thing that it asks is how many theories, models, and frameworks do you want to compare? And then what are the names of those that you want to compare? And so for somebody that's just starting in implementation science, even that can be a daunting task, because which ones do you pick? Which ones make sense to compare? What am I going to do? And so you can just put in some random stuff, but how helpful is that actually? And after you've picked your theory, model, or framework to compare, you've then got to select what criteria you want to use to evaluate them. And then you rank them, it gives you a score, and then it spits you out a beautiful PDF to your email and just provides a summary of everything you've put in. And now you're left with making a decision between which theory, model, and framework am I going to use. So I think this is a great tool for people who have an understanding of what they want to get out of it. But for beginners, it's not particularly useful, I don't think. So what is really helpful, I think, for people that are getting started is examples. And examples are really helpful because they provide some inspiration. They provide inspiration around what kind of research designs you might use, around what theories, models, and frameworks you might use, how you might use them, what combination of theories, models, and frameworks you might use. So I think they're really helpful. And they also provide you with a guide for how you might go about picking a theory, model, or framework. And really what's particularly helpful about examples is that they can increase the similarity of the implementation methods that are being used across different studies. And so this is something that we call replicability. And the reason that it's so helpful to have increased similarity across our studies in terms of methodology is because it gives us a deeper understanding of what works for who, why, when does it work, how does it work, so that we really get to the heart of why different implementation methodologies work in different contexts. And once we have that deeper understanding, hopefully implementing the next intervention is quicker because we can very quickly learn from what other people have already learned. So the great thing about Child Bright is we have so many examples of implementation studies. So these are all of our studies, the titles of our studies, and they are long and small. And I apologize for that, but we are going to talk through them in a second. So we have these great implementation science research projects that are happening across the network. But what is it that connects all of them together, and how can we understand what's happening across the network? So one of my main projects here with Child Bright is to map the methodologies across the projects. And so using the internal project protocols that were submitted by the team at the start of this phase 2 of the network, I am asking the question, what implementation science, theories, models, and frameworks are the network project using, and how are they using them? And the second question is about how do teams choose these theories, models, and frameworks? And today we're just going to focus on question 1. So a very quick tour through all of the projects, because there are a lot of them. So we have the Parent Voices project, and this is targeting parents of children born very preterm attending neonatal follow-up. And they're implementing a new practice, which is the administration of parent-reported outcome measures to improve clinician awareness of parent concerns about their child's development, as well as to improve parent satisfaction with the care and their attendance at appointments. Child Right Coaching is targeting families of children with suspected developmental delays and that are currently waitlisted for diagnosis, assessment, or services. And this is a new virtual coaching program that is sharing information on child development, navigating the healthcare system, and promoting family resilience. And this program was born out of recognition that our waitlists are really long and that parents need support and empowerment during this time. The ADAPT project is targeting parents of high-risk infants transitioning from neonatal intensive care units to home. And this is also a new program of increasing access to a navigator for 12 months after hospital discharge to support parent wellbeing and education around how they can care for their new infant. And this program is aiming to help parents feel with feelings of being overwhelmed and isolated at this critical time when they're going home with their infant, as well as recognizing that parent wellbeing can really impact on infant outcomes. The GRIP project is focused on children with suspected rare genetic diseases, including various brain-based developmental disabilities. And they're looking at a new procedure, which is the expansion of workflows at genome-wide sequencing in Ontario. And they're looking at this expansion of workflows to increase access to genetic testing via non-genetics providers such as pediatricians and neurologists. The Pain Pathway program is targeting children aged 6 months to 18 years with severe neurological impairments who can't tell us where it hurts. They have a new clinical pathway, which is providing guidance to pediatricians on how they can assess and manage pain of unknown origin. And the goal here is to reduce pain and irritability for children who can't communicate their pain location, cause, or type. Bright Care Pathways is targeting children with congenital heart defects, and they also are working on developing a clinical guideline for timely developmental follow-up for children with congenital heart defects. And the goal of this project is to increase our timely identification of developmental impairments and functional challenges in this population to facilitate access to resources and reduce the impact on long-term outcomes. The VREF project is targeting children aged 6 to 17 years with a diagnosis of attention deficit hyperactivity disorder. And they have a virtual reality game that's training executive functioning. The reason for this is that people with ADHD tend to have difficulty with executive functioning, and there's a lack of tools available to help improve executive functioning. The JUA project is targeting youth and children with disabilities, and it's a mobile app to help identify disability inclusive community-based leisure activities. And they're really hoping to increase awareness and engagement with various adaptive inclusive leisure opportunities within local communities. Bridging the Gap is focused on children with neurodevelopmental disabilities, and they're really trying to look at the principles that decision makers like healthcare leaders and education leaders use when they're selecting psychosocial interventions for children. And they're also exploring what principles scientists think that decision makers use to highlight this gap that we believe exists between what decision makers and scientists think and to hopefully increase the likeliness of uptake of these kinds of interventions. And the Interplay project is focused on caregivers of children aged 3 to 24 months with hand asymmetry due to suspected or confirmed hemiplegic or triplegic cerebral palsy. And this program is a parent-led play-based therapy, engaging children in enjoyable activities that encourage movement of the targeted hand, with the goal of improving hand symmetry in these children. And so that's just a really quick tour through the projects, just to give you an idea of the variation in populations that we're talking about, as well as to give you an idea of the variation in kinds of interventions that we're implementing across the network. And so coming back to our study and thinking about what framework did we use for mapping, because of course we use an implementation science framework to do this. So we use the Ottawa model for research use. And that this is what we call a process model, and it really breaks implementation down into three really simple steps. So we're talking about assessing the environment. So we're talking about our barriers and supports, the barriers and facilitators. We're talking about monitoring our implementation project, and then we're talking about evaluating it. And so under the assess category, we're thinking about the innovation, which is the intervention that we're implementing. We're also thinking about the people who are going to be adopting our intervention, and we're thinking about the kind of practice environment this is happening in. So whether it's happening in the patient's home or whether it's happening in a hospital or a community setting. Then when we think about the monitoring, we're thinking about monitoring this intervention is the implementation intervention. And so we're thinking about how we're monitoring actually what's happening and if anything, any new problems are coming up in our implementation. And we're also thinking about the adoption. So how well was the intervention received initially, and then how are we sustaining that along the way? And then evaluating our outcomes across patient, practitioner, and system levels. And so to do our mapping, we had myself and a research assistant reading all of the project protocols. And each time a theory, model, or framework was mentioned, we wrote it down in a matrix in Excel that was organized to include each of these stages and concepts from the Ottawa model. And we also wrote down what step or category of the theory, model, or framework the project said that they were using. And so I'm going to share our mapping in the next couple of slides, but please know that we're still very early in this project and we haven't yet had our team data interpretation meeting. And we also haven't double checked our mapping with the project team. So if you're on a project team and you see something that doesn't look right, please email me afterwards and we can talk about it. So this is our very high level mapping framework, and I don't expect you to read all of it. I know it's quite small and there's a lot of information, but just a quick orientation to this table. We have along the top row all of our project names, and then our top row. The first column that we have on the right is the stages of our Ottawa model. So we have the grey rows are our assessing of barriers and facilitators. We have our monitoring and we have our evaluation. And then in the white rows, we have our concepts under that. So under assess, we have innovation, potential adopters and practice environment. Monitoring, we have of the intervention and adoption. And then under evaluate, we have our outcomes. And all I really want you to take away from this slide is that all of our projects are using theories, models, and frameworks. Most of them are using multiple theories, models, and frameworks. And there's also a lot of similarity. So we're going to have a look at what's happening in a more nuanced way. So looking at our process models, so we've got our 3 projects here that are using a process model to help guide the implementation project. So we have the Bright Care pathways are using the knowledge to action framework. So Celia shared a picture of this at the start. It was the circle with the funnel in the middle. And so they're moving through the stages of knowledge synthesis and adapting the knowledge to a local context. We then have the Parent Voices project that are using PDSA cycles, which is a plan, do, study, act. And these can be quite rapid cycles of improvement. And so we're thinking about planning what we're going to do, doing what we said we're going to do, studying what happened, and then acting upon it and making changes, and then starting the process again. And then we have the Pain Pathway project, and so they're using the NERN Active Implementation Framework, and NERN stands for, I think, the National Implementation Research Network. And so they break implementation down into exploration, initial implementation, and full implementation. And within each of these categories are a number of steps and things that you can think about. We then have determinant frameworks, and so we can see that most of our projects are all using a determinant framework to help them understand barriers and facilitators. And so just zooming them in so you can see them a bit better, but really the key takeaway from this is that most of our projects are all using the consolidated framework for implementation research, but they're all using different constructs of the CIFA framework for different reasons. And so once all of our projects are done, this provides us with a really great opportunity to understand the different aspects of, say, the inner setting, so what's happening within the healthcare settings that all of these projects are operating in, what's common across, what can we learn from this, and what can we leverage to go forward. And then our evaluation framework. So again, most of our projects are using some kind of an evaluation framework at different stages, but mostly at the monitoring and evaluation steps. And the really common ones are the REAIM framework, so reach, effectiveness, adoption, implementation, and maintenance. But again, they're looking at slightly different things across the projects. We also have the Proctor model, the Proctor framework, and that kind of has 13 different implementation outcomes that you might want to measure. And we have some projects that are also using the APPEASE framework, which is more looking at the strategies and thinking about how well suited they are to the project that you're doing. So the key takeaway messages, because I know that that's a lot to understand, and different people on the call are going to take different things away from those tables, and we're still working on unpacking them ourselves. But really the key message is, as Celia said, theories, models, and frameworks are a really useful guide. You can use multiple theories, models, and frameworks as they serve different purposes. And as we saw, a number of projects are using a combination of process models, determinant frameworks, and evaluation frameworks. It can be confusing to know what to use, but you can learn and borrow from other projects. And that's something that we're really hoping to put on display at the end of this project. Is we have 10 wonderful examples of how we can implement projects for brain-based developmental disabilities. And so this is a really great opportunity for us to learn from ourselves, but also from other people to learn from us. And you also only need to know 1 or 2 theories, models, or frameworks to get by. So yes, the projects are all using multiple frameworks, but they're actually not using all that many. So don't be overwhelmed. And so this really comes down to, you know, we often think that to get practice in, to get evidence-based research into practice is just a linear process of going from A to B. We have this great thing, and we're just going to get people to do it. But really, it's so much more messy than that, and that's why we need implementation science to really understand the messiness and how we can make sense of it. And now handing over to Pierre. Thank you very much, everybody.
Thank you, Simone. So Sheila, do you want to do the quick poll, or do we want to do questions first?
I think we've got time for questions, so people can start to think on those.
All right, yeah. So with that, we'll open up the floor to you all. So feel free to raise your hand, unmute your mic, or add a few questions in the chat box, and we will engage with Celia and Simone.
Go ahead.
All right, hi, Alifa, you have the floor.
Oh, thank you so much. Thank you for such a very succinct and very very wonderfully planned out and very methodical presentation. Very helpful for me personally. I guess my question is a little bit maybe awkward or odd as I'm thinking of it. But in implementation science and from your, I guess, expertise and where you sit and the way that you probably use both of the things I'm going to be asking about, can you kind of give an example as to why you may or may not go with like proms or prems or any instance in which you would use both of those types of measures in implementation science, or what do you see the benefit of being of one over the other? Sorry, very messy question. I acknowledge that. So feel free to pick it apart any which way that makes sense to you.
So I can start us off, and I think understanding patient-reported outcomes and patient-reported experience measures. Sorry, I got my terms wrong, but is part of implementation science. It's one of the factors and one of the ways that you are knowing if you're having making a change. So I see them intricately connected. So we talk about implementation and all of these. What's the context? What's going on, and how do you show that you're having some of the impact? And I think some of those pieces is where those types of measures really come into play. So I think there's a lot of complementarity to thinking about that, and it gets a little bit more specific in terms of what your measures are, what you're really looking at. I hope that helps.
Yeah, just adding to that, Celia, I think there's definitely a role for them, but thinking about in order to be successful in your implementation efforts, they really should be co-designed. And so whether that's with patients, whether that's with clinicians, educators, whoever it is that needs to be engaged in either the doing of the implementation or the receiving of the intervention, they need to be engaged. And so that's where I think the proms and prams really come in. And so you might want to do them formally, because if you administer a standardized measure or some kind of measure that's been used before, or even if you make it up to be project specific, if you administer them before and after your intervention, that gives you a really good idea of whether or not you're actually addressing the needs of the people who are receiving your intervention. But you can also gain that information in informal ways through maybe you do focus groups or interviews or just having a conversation with people. So I think it's just the tension between whether or not you need to formally use proms and prams, or if you can obtain the same information in a less formal way. And that depends on what it is you're trying to do and the timeframes that you have available to you.
Thank you. That was so incredibly helpful. And I think that both of you provided me with insight that actually makes it more thoughtful and more not only thoughtful, but also kind of gives the leeway to use other things as in complementary ways if those two methods are not necessarily decided as things are being designed. So thank you so much.
Thank you, Alifa. Simon, you have your hand up.
I do. Hi, thank you. That was really great. I certainly feel like I've had a lack of understanding of maybe exactly what implementation science was, and that was certainly very helpful, especially the kind of connecting it to the research. I guess my question, I'm not a scientist, so my question after being in this organization for quite a long time is, once you have the outcomes from implementation science research, who implements that?
So do you mean like we're understanding what comes together from these specific projects and these implementations? And are you asking about the next step? Who brings it together?
I guess I'm understanding more like that it's researching what methods can shorten that kind of like, let's say 17-year gap, let's say to 7 years, so we can implement good practices. But so we're researching the method. So once the method is determined, or once different ideas are determined, how does that get implemented? Because it seems like implementation science is a research. So I'm thinking about like, well, how does it get actually into the system if in itself it's a research project.
Yeah, and that's a great point. And it goes back to that arrow between my definitions of implementation practice and implementation science. And there has to be a connection there. Because if we're just studying the methods, that's not very useful. So it's figuring out how do you bring that into the next project? And some of that is sharing your learnings. The next project finds some of that study. It's using a similar way, and you're building up the overall evidence that people can continue to draw from and learn from. And I think there's a role for project teams to look for what has been done before and learn from some of that and what makes sense about what brings that forward. And from implementation scientists that need to do a better job of making the consolidation of all of these pieces something that's actually useful. And that has been a big challenge because you get too much into the academic focus, and then that's an interesting academic question. But if that doesn't really help, then that's not the point of the sciences. So really trying to learn as much as we can, and also knowing what some of the gaps are, like some of the ways that we make some of these changes that we don't understand. And I work in a lot in how do you actually scale something? So it's working well in one setting, how do you get it used somewhere else? And there's so little that we know from a research perspective around that, but it only makes sense to study some of that if you can actually use it and apply it, and people can benefit from that to do better scaling. So it is definitely a full process that we need to do better at. But there's the kind of, yeah, bringing it back to the reason for understanding.
All right, thank you. Is there like a liaison between those two kind of bubbles that needs to be created so that it drives that kind of scaling up together versus separately?
Part of, I think there's a few different pieces. So one, some of the training around what do we mean by implementation, not being experts in it, but then working with people that can bring in the other pieces and kind of make some of those connections, I think is a part of that process. So getting the right people and that collaborative approach across so many different things, and then that collaboration leads to other connections is what I'm hoping for as well. And Simone, you can add in.
Yeah, I think there's also a role of thinking about having people embedded within healthcare systems as well that have these implementation skill sets. And so something that we talk about a lot at the IWK Health Centre is, so we have researchers that are working with our clinical team. And while we are doing research on different projects, often they're identified by the project teams. We need to make this change. Then we will help them develop a project plan. We see what's happening, and then we, might do our publications on the side about what's happening and how we implemented something so that other teams and people can learn from it. But a part of our role we see is also teaching the teams that we're working with what are the implementation methods that we're using, and how can they take what we're teaching them and apply that to the next project. And so I kind of think about it as, the saying about, you can give a man a fish and they can eat for the night, or you can teach a man to fish and he can eat for life. So it's kind of like this teaching of people how to do things so that they can continue to do what's happening over time. And I think that's part of that connection piece, right? Like, because not everything's going to be a research project. And in fact, most of the implementation work that's happening everywhere is not research, but the implementation science piece is gathering the evidence for how people who are doing the implementation can do it better.
It's a much better answer, definitely involving the people and training and bringing that together. Pierre, you are muted.
Yeah, we've only had Zoom for a few years, right? So I realize we're at the top of the hour. So if I just want to thank Simon for his great question. And so if you think of any other queries in the day or so, feel free to email them to me, and I'll be happy to relay them to Simone and Celia, and we can certainly get back to you with an answer. And quickly, as we wrap things up, just a few minor announcements. So if you are if you are with the Child Right Network, just a quick pitch that next week we are switching things up a bit, but we have our networking session set for next Wednesday at 7 p.m. Eastern. So we're trying a bit of a different time zone to see if that helps folks with their schedules and availability. So if you are free, feel free to sign up. And we'll send that link out with our follow-up email. And again, just an invitation, if you haven't signed up yet, we have our next session in this series set for May 15th or May 14th. So feel free to sign up for that and share us if there's any folks in your network that might be interested. And then lastly, we will follow up in that email in the next day or so with a link for you to provide any feedback that you have in the session, and that'll be an opportunity for you to provide any thoughts on possible topics that you would like to see covered in this series or in additional series that we do put on throughout the year. So with that said, thank you so much all for joining. Thank you, Simone and Celia, for walking us through that, and we look forward to seeing you next time. Take care. Bye-bye.